So it's very exciting to think about how technologies could benefit not just hospital, but every one of us and our loved ones over the technologies in healthcare. And to start this afternoon, Mr. Brian Sun from Intelligen will introduce an innovative AI 3D imaging platform that enhances visualization and precision in diagnosis. And please give a big applause to welcome Mr. Sun to the stage.
Technologies. So, what is Anatomy Cloud? Well, we are a company that have developed an AI platform that is dedicated to turning 2D black and white images, the data comes from CT MRI, into 3D models using AI without any manpower. Here is a short video introducing what we are doing.
Anatomy Cloud, AI 3D medical imaging platform. Anatomy Cloud's pioneering AI technology provides cloud-based medical imaging services. One-click process from DICOM files in 3 to 5 minutes, identifies over 100 organs and tissues automatically. 3D images automatically stored in each department's database. Supports PC, mobile, tablet, and XR devices. Improves usability and convenience of 3D medical images. How 3D medical imaging transforms healthcare. In radiology, CT, MRI scans are sent to the AI center, instantly converted to 3D, and saved to departmental databases. During consultations, explains conditions and treatments, improving doctor-patient communication. In education, students learn with real 3D cases, improving training efficiency. Pre-op, physicians plan approaches, increasing surgical efficiency and quality. Notable surgery cases. 1. XR robotics liver tumor surgery. 3D image helped locate an extra tumor. XR overcomes the system's limited viewport. 360 degrees magnification reveals structures and lesions. 2. XR coronary artery occlusion surgery. Contrast agents couldn't show the blocked artery. AI restored vessel pathway in 3D. XR navigation guided the correct surgical route. Coupled with communication software. Allows telemedicine, remote surgical assistance, online education, and more. 3D medical image, anyone, anytime, anywhere.
So, now we've seen the 3D images, but we're in 2025 now. When you go see the doctors, what the doctors still show you are black and white images, either from CT, MRI, or X-rays. But however, turning 2D to 3D, that sounds very, very simple, but why are we still stuck in the age of 2D black and white? The reason is very simple. There are too many hurdles to go through. First, a hospital will have to buy $1 million equipment from Philips, Siemens, or Fujifilm's 3D workstation, and then you have to get specialized doctors, radiologists to operate on that machine manually. So you have to spend 30 minutes, hour, or even longer if the conditions are very complicated. And afterwards, you can only see the 3D models on that machine. We are already understaffed in hospitals, and now you have to ask doctors to spend extra hour to do whatever, just to create a 3D model for one cases. Obviously, that's why we are still stuck in the age of 2D images. We are bottlenecked. We cannot produce enough 3D image for every single patient and doctors. But using our 3D images, you can see we can help in such ways. This is one of the doctors in Taiwan that he is actually using goggles to mark the location of thyroid cancer. And also 3D operating on a brain tumor. You can see the surgeon with the goggles on. He is actually operating on the patient. But like I just said, there are many troubles right now. High cost, high learning curves. high learning curves, slow conversion speed because it's manual. It's hindering us from progressing from 2D to 3D. We're still stuck at old cell phones. We have to move forward into a new age of smartphones using iPhones and new technologies. So what exactly is Anatomy Cloud? We are an online platform where doctors can just simply upload their DICOMs, and in 3 to 5 minutes, we return them into 3D. Our AI can do automatic segmentations for over 120 different body parts, and requires no extra manpower. You just drag, drop, and click process, and everything will be done in 5 minutes. And we do not need any extra hardware. You can use simply any PC, smartphone, tablets, any goggles. We're compatible with all of them, and no installations required. So here's a sample of how we convert to 3D. You can see this is just a plain old DICOM from a CT file. So you just drag the entire stack from a folder and click upload. We can also support that you can pick any part you want, but we pick all. And in 5 minutes, this is the result you will see. Every single part of the body are actually segmented. This is not one single 3D model. This is actually hundreds of 3D models all combined together. And we support that you can see the part you only want to see. So for example, you select the heart. You can isolate the heart. You can see you can carve out the arteries, the coronary arteries, and the heart itself. So here's a simple kind of like structure of our service. So from the CTMR scans through our AI platform. And our platform can act as a storage. You can access all of your data online, and then you can use the 3D models for your clinical application, and finally for educational purposes. First, cloud storage. You can see, as you can see from the layout on the right side, if you log into our system, all the image you have converted into 3D will be easy to find, all sorted out and ready to use anytime, anywhere for anyone, as long as you have internet connection. And first off, you can use it for clinical application. This is one of our doctors we collaborated with in National Taiwan University Hospital.
这都可以提供传统解说所不能提供的视觉模拟的效果，所以病人可以获得身临其境的体验以及病情的说明。
就是目前我们
They can share
看
the
到的
image.
大概
Everything is down in 3D and
比
fully
之前那个
understandable.
黑白的 X 光看更清楚、更了
So
解。
even non-health professionals can understand what exactly the situation they're facing, and also their families, their friends can also understand as well. And third, for clinical surgery. So the doctors can also, while wearing the goggle, they can look at the 3D model. They can do pre-op planning by themselves. They can look at it 360 degrees. They can see what part I have to avoid, what part I have to look out for, where is the tumor is located. And afterwards, while still wearing the goggle, he or she can walk into the operating room and operate while using the 3D model as references. As you can see on the picture, you can overlay it onto your patient, and you can already see where the tumor location is or where the medical condition is without opening them up. So once you start operating, the incision point can be very precise and small, increasing efficiency, lowering the operation time, and but also improve success rate and faster recovery for patients. And finally, when the treatment is done, you don't have to put away or store away the 3D models. The 3D models themselves can pass over to medical schools. These will all be real patient data with real cases, and even maybe sometimes rare cases you cannot find an example of, and you can pass them over to medical schools. And maybe you can get the operating surgeon to become a lecturer, teach the students what they have to look out for when they perform this surgery, anything they have to look out for, and everything is also in 3D. We have to be honest, not everybody can immediately transform the DICOMs into 3D model in their head. Sometimes we need a much more direct reference. So we turn them into 3D already for all the students, all the hot doctors, so they don't have to do it by themselves, which may or may not have human errors when they want to make decisions. So here's a clip we have in hospitals in National Taiwan University where they do lectures using our 3D model. So there's a lecture on blood vessels around the femur area. As you can know, if you're looking at 2D, sometimes the blood vessels, they look like they're all on the same plane. So if you turn 90 degrees, you'll see that actually some of the artery goes in front of the femur bone, and some goes from behind, which may be hard to tell for first timers. But using our system, we can actually increase the efficiency of training doctors. Essentially, we're able to bring more of the next generation of doctors online faster. So here are some of our cases. So in the first video, I showed a little bit. This is one of the robotic liver tumor surgery using the Da Vinci robotic arms. This was operated in McKay's Memorial Hospital in Taiwan. The problem is that, the problem with 2D black and white images is that sometimes it's very ambiguous. The doctor, while he is very professional, but he made a diagnosis that there are only 8 small tumors located all over the liver. But once going through our AI, we turn them in 3D, he actually noticed that there actually is a 9th tumor. And also a problem with Da Vinci is that the screen is very small, and you cannot really see behind what you're seeing because of the cameras. Like, what about the backside of the liver? You have to flip over the liver to look behind, like, kind of like a wall. But using our system, you can already see the 3D, the structure, everything in your hand. Here's a video of it.
让协助医师确认肿瘤位置方向。3D 影像同步显示在达文西界面。
只有8颗，你帮我找出第9颗。
Thank you. There's only 8 he only diagnosed, but he actually found 9. So the benefit of AI is that we can remove the ambiguity. Sometimes the doctor have to, there's a gray spot, whether that's a tumor or that's something else, they don't know. But with AI, there you go. It's some anomaly. Oh, it's not an anomaly. We can actually help the doctors make the decision with providing them with more information. And here's another case we have helped. This one is also in National Taiwan University Hospital. It's for coronary artery blockage. So it's a very common disease where people with obesity they'll have clogged up arteries. So the problem with this is that if you go through CT right now, even if you have contrast agents, because the blood vessel is blocked, it doesn't flow through. So the CT will still come up totally black with no indication of the blood vessel anywhere. So usually when they do PCI, they actually have to do it blind. They have to poke in the kind of like wire thing, and when they hit a resistance, they have to guess whether they're actually poking at the blood vessel wall or actually the blockage itself. So usually, if they doesn't feel like it, they'll call it off, and the surgery will become a failure. Even in the United States, the national average of successful PCI is around 60%. But using our system, the AI can detect the slight difference of muscle mass between the heart and the blood vessel. We can actually reconstruct the entire route, entire layout in 3D. So in National Taiwan University Hospital, they actually used our system to perform 7 coronary artery PCIs, and all 7 of them were successful. We successfully raised the success rate from 60% to over 90%. They even wrote a paper and actually applied for patent, and now they wrote the paper and it's on the journal. I think they're about to be published soon. So here's a video. On the left is the original image. On the right, we can reconstruct them.
3D 影像协助医师确认关脉疏通方向，顺利打通阻塞关脉。
remove the blockage. So here's our partnership hospitals in Taiwan. And currently, there are 3 of them right now in Taiwan. We have already fully adopted our system, which is the Taiwan McKay Hospital, Shuanghe Hospital, and also National Taiwan University Hospital in Hsinchu. So what they do is that now we have successfully helped them become a much more digitalized, smart hospital. In that everything, now all the black and white you see in hospital are 3D. When any patient, they goes into to see the doctors, everything they see will be in 3D. No more 2D diagrams they have to sift through, look around, or explain everything in 2D where the patient, they don't understand anything. Now everything is in simple, clear-cut 3D models. And right now, we're also trying to expand out of Taiwan to help around the world, and to improve healthcare services, healthcare qualities all over the world. Like, okay, this is my personal info. It's my WhatsApp and LinkedIn. So currently, our hospital, our company, we are providing a free trial of 3 months to 6 months for our service. So where everything can now be turned into 3D. And if any hospital is interested, we can contact me and we can talk further. Thank you for listening.